Welcome to another night of Fresh Natural Live. Happy Labor Day to all of you out there. I imagine many of you are enjoying your time off. Some of you probably had to work today. I did a little bit of both. But tonight we're going to have a brief little discussion on the health benefits of exercise. I think you're really going to want to um, um, not miss this. I'm going to give an overview of an article that I read. It's a pretty long article. I'm just going to give a summary of it. And then I'm going to go through some general, well-known or fairly well-known health benefits of exercise. And after that, I'm going to give you my insight and my approach to exercise. And actually, I'm going to talk about a new program that we'll be starting at Montgomery Heart and Wellness that you'll hear a lot more about later. So stay tuned. Let's get on the other side of the start of the show and let's talk about exercise. Okay, happy Labor Day again, everyone. And we're going to talk about the health benefits of exercise. We all have a general insight uh, of the fact that exercise is beneficial. And we generally know that it's good for improvement of strength and maintaining a healthy body weight and the like. But unfortunately, there's not a lot of science that goes into truly understanding the mechanisms of the benefit of exercise. And so I'm going to review an article that looks at a lot of the available data worldwide. But even in this setting, when I reviewed the article, I found that there was not a lot of detailed understanding in terms of the mechanism of effects of exercise in certain diseases. But they did cover a broad spectrum of disease types. And what I found was that there was a there's a finding of universal benefit of exercise. I'm not going to go through the nuts and bolts of this article, largely because it's a pretty extensive article, but I'm going to leave this title up for a few minutes for you to look at. I would invite you to pull this article out and review it. I think it's a reasonably easy read for those who are both medical experts and those who are not. And so I think you'll get a lot out of it. It can serve as a reference. For instance, if you have a certain health condition or have a loved one with a certain health condition, I think you can reference this article and maybe look at some of the studies that they reference and talk about it. So, but before we get into some of the nuts and bolts, I want to invite you to hit the like button or give us a love reaction. And also hit the subscribe. If you haven't subscribed, and share this with any loved ones or friends that you think would benefit from this information. So exercise as medicine. I like the beginning of this title, evidence for prescribing exercise as therapy in 26 different chronic diseases. So what these authors did, they searched the medical literature and they reviewed 26 different types of diseases. Psychiatric diseases, the class for psychiatric diseases, metabolic diseases, cardiovascular diseases, and also pulmonary disease. And they also looked at some data in cancer. And essentially what they found across the board, there was benefits to exercise. So let me just go through some of this. I highlighted some of these, but for instance, if you look at the effects of psychiatric diseases, depression. And depression is fairly common. Many individuals become depressed for different reasons. Many individuals are depressed usually due to, or frequently due to, social events, a loss of a loved one, a loss of a job. There's postpartum depression that women can go through, and there are many other mechanisms of depression. However, they found that clear evidence of exercise improving depression. I can identify personally when I was in medical school, I went through a bout of depression when I was a third-year medical school student. But looking back, what I realized that up until my third year in medical school, when I was exercising every day, I started, taking call with the interns and residents. As a medical student, I wasn't exercising. I immediately stopped exercising for a prolonged period of time, and depression hit. Once I started exercising again, it just went away. I never sought any help or got any medication, but I know for a fact personally that it has a beneficial effect on depression. And many people are depressed for lots of reasons. So you may have a lifestyle that consists of, working long hours, being indoors a lot, not eating healthy, not moving a lot. And so you adapt to that lifestyle and your mental state is what you may consider normal. Then you may get hit with a sociological stressor, if you will. You may lose a job, you may lose a loved one. And then that may trigger a sense of depression because your response to that external stress or external loss may be blunted by the fact that you don't have a healthy lifestyle to start with. So it's understandable how depression can help, or exercise rather can help anybody in the setting of depression. They talk about possible mechanisms. Increasing beta endorphins and monoamine concentrations in the blood are some of those things. And you may think about why people may eat based on emotions. Sugar is one of those things that, has a dopamine effect, has an endorphin effect. So we may eat, bad diets to stimulate those receptors that are not being stimulated normally with exercise. Many of you may be familiar with the runner's high, buildup of endorphin levels and the like. And so you have a situation where when you're exercising, these endorphin levels build up and they give you a sense of euphoria, a sense of well-being. And this happens if you maintain exercise on a regular basis. These levels are maintained and your sense of well-being and euphoria is maintained. So if you're not exercising, these endorphin levels could decrease and therefore you have a decreased sense of euphoria, and you can simply reverse that with exercise. And epidemiologic studies indicate that regular physical activity helps prevent symptoms of anxiety, as well as depression and the like. Now, they talk about evidence-based training. Most of these studies oscillate between aerobic exercise and weight resistance exercise. Most of the time, aerobic exercise with high intensity, high interval training aerobic exercise tend to be the best. And it really crosses over between aerobic exercise and increasing resistance. So if you do a high intense exercise, you're really doing an exercise that's aerobic, and because it's high intense, there's some level of increased resistance. So if someone's sprinting or someone running upstairs or doing lunges up an incline, there's an aerobic component to it, but also you're doing lunges or running up an incline, there's an increased resistance. So high intensity exercise frequently combines aerobic and increased intensity. So you're really getting the best of both worlds because you want to increase cardiovascular benefit, but you also, with the increased resistance, want to increase muscle mass and certain types of high intensity exercise like lunges and leaping and things like that also help with balance. So we go through the different studies they looked at. I made some notes here for myself. They looked at schizophrenia. Again, a positive benefit with patients with schizophrenia. Again, aerobic exercise was, along with some resistance training, was found to be beneficial, but the benefits lent toward more high intensity, either moderate to high intensity exercise. As they said here, largely aerobic exercise done in small groups. There's also a psychosocial component of exercise when you're working out with groups. That can help people with mental disorders such as schizophrenia, such as as depression, even anxiety. With anxiety, they found that by increasing heart rate and blood pressure, patients became aware or less anxious when heart rate and blood pressure increased, and also it blunted the increase in heart rate and blood pressure. So, for instance, people may get an increased heart rate and blood pressure if they're dehydrated, but if they have a sense of anxiety towards that, then they may become more anxious, and therefore adrenaline increases, and the increased heart rate and blood pressure is exacerbated. Dementia, as we have long known, is benefits from dementia, and there's a lot of evidence on the prevention side of dementia. But again, physical exertion, aerobic exercise, resistance training is beneficial, but also things that require coordination. So, for instance, if you're doing dances or certain types of exercise that require coordination, so muscle memory, that tax the muscle, I think also has been found to be very beneficial in dementia. So in that situation, dementia, and similarly, Parkinson's disease had benefit with exercise, aerobic and endurance, aerobic training, high intense exercise, some resistance training was found to help gait and movement and reduce the rigidity. Stretching and flexibility was also found to be beneficial in patients with Parkinson's disease. As we move down the list here, and then they really found no significant absolute contraindications in most of these. There are some with musculoskeletal disease and some other disease I'll go with, but from the standpoint of mental disorders, no, the neurological condition had no absolute contraindications. Multiple sclerosis, there was benefits found in exercise with multiple sclerosis. Individuals who exercise, again, high intense exercise, interval training was found to be beneficial. Aerobic, but also resistance training was found to be beneficial to a certain extent. In all cases, exercise had to be individualized. So that's an important thing that they came up with. And that goes without saying, someone, despite your disease state, you're going to start off at different conditioning levels. And many of these individuals with psychiatric disorders have other comorbidities like musculoskeletal issues and obesity and cardiovascular issues. And so you always have to individualize exercise. Now, going to metabolic diseases, obesity, we all have a clear understanding that, exercise can help you achieve and maintain a healthy weight. It usually works best when there's a healthy diet. So, you can't outrun, the favorite cheeseburgers or fried foods or whatever the case is, because there are metabolic things that contribute to increased weight, such as increased fat cell, increased fluid retention. That's going to keep your weight up if you're putting toxins inside your body. So you can't just outrun toxic, consumption of food. Even though you may burn calories, you're not removing those toxins effectively if you're eating a toxic diet. So obesity and all of these conditions really work better with exercise and combined with nutrition. And that's what I'm going to discuss with you later. So obesity, they talk about a U-shaped association. Of course, people that are too small have increased morbidity to mortality, as well as people too high of a BMI. But the key thing with obesity, aerobic and high intensity interval training is very good for obesity. The interesting thing they found in looking at the data on obesity is that they found that people with normal BMI who were not fit had an increased mortality despite the fact that they had a normal BMI. So an increased mortality twice as much than unfit people, regardless of BMI. And the other thing is that in their studies, and again, they looked at multiple studies, they saw that people with a high BMI who were either overweight or obese but fit did better than people who were non-fit who are not overweight and over obesity. So there's a physiological component that goes with fitness. And what that implies, it implies that when your body's physically fit, there's an underlying biochemical and physiological milieu, if you will, that's favorable to your longevity. And so even though your body is overweight, and the body that's overweight is overweight because you may have increased toxins that you're putting into your system, and the body puts those toxins aside with increased fat cells and increased fluid retention. So you may be physically fit and overweight because you're exercising and getting the benefits of that. But you may not have an optimal diet. You may not be detoxing, etc. So your body may be just putting those toxins aside, so you carry extra weight. However, because you're fit, you're compensating for those things. And so there's a compensatory mechanism that you can have. But to get the optimal benefit of well-being, you want to be fit and be at a healthy weight. So that means optimal nutrition and optimal exercise. Hyperlipidemia has been shown, exercise has been shown to benefit hyperlipidemia. The mechanism here was found to be due to increased lipid metabolism at the skeletal muscle level. And so the training was thought to be beneficial, increasing lipid turnover at skeletal muscle level. And hyperlipidemia also is related to not only skeletal muscle metabolism, but also liver metabolism, that they didn't see much effects on liver metabolism. I think liver metabolism is going to be affected more by the food that you consume or the food you don't consume. So let's look at metabolic syndrome, which is very closely related to diabetes. Type 2 diabetes is an insulin resistance component there with people who are overweight. Again, high intensity interval training has been found to be beneficial, as well as aerobic training, which high intensity interval training is aerobic, as well as having a resistance component. Resistance training is good. Resistance training is good because it helps you build up muscle mass, and muscle mass helps you build up basal metabolic rate. And so it, over the long run, can help you with weight loss because your basal metabolic rate is increased. Increasing a plant-based diet also increased basal metabolic rate. And so possible mechanism is multifactorial. It affects lipids, it affects hypertension, insulin resistance. Exercise, we're going to go to type 2 diabetes here. Whoops, I think we passed type 2 diabetes, but type 2 diabetes and metabolic syndrome can be lumped together. There's an insulin resistance component that's driving both of those. And exercise is known to increase insulin sensitivity. So that's an important part. And if you're taking insulin, this is especially important if someone's a type 1 diabetic that also benefits from exercise versus type 2 diabetes. If you take an insulin or some agent that lowers blood sugar, monitor your blood sugar carefully, because if you start exercising aggressively, you need to make adjustments, and the medication you're consuming that lowers blood sugar. Polycystic ovarian syndrome is a condition diagnosed in women with multiple cysts on the ovaries. It's associated with hormonal imbalances. Insulin resistance is among the findings that they have. There's syndrome of infertility, insulin resistance, obesity, and hirsutism, or increased excess hair growth. That's described in the syndrome. But the metabolic impact of exercise is similar to that with type 2 diabetes, increasing insulin resistance, and these patients benefit from it. As I mentioned earlier, type 2 diabetes is very similar to metabolic syndrome, and they also show benefits on type 1 diabetes. Now, type 2 diabetes is an insulin resistance syndrome. Type 1 diabetes is an autoimmune type disease in most cases. Now, you can have a chronic burnt out pancreas for metabolic reasons as well, but most of the time we see type 1 diabetes as an autoimmune process where the immune system attacks the pancreas. It's essentially scarred down, it's ineffective, and you're required to take insulin. The benefit in type 2 diabetes, as I mentioned, insulin resistance is reduced. There's some other metabolic benefits. Certainly weight reduction is helpful, and that also contributes to insulin resistance improvement. Type 1 diabetes, however, there's a benefit that's at the lipid metabolism level. So they showed there was some decrease in overall cardiovascular risk, but this is not necessarily due to the fact that there may be a decreased requirement of insulin as well, because people with type 1 diabetes, if they're leading the standard American lifestyle, there may be some insulin resistance in addition to the fact that their pancreas doesn't make insulin, so they require a large amount of exogenous insulin. So we know from a nutritional standpoint, when we put them on an optimal diet, they have a lower insulin requirement. And the same thing is seen with exercise. So you put those two together, you require less insulin, which has benefits. And other things like hypertension and hyperlipidemia, these things are affected favorably in this condition as well. There are some precautions and contraindications, both in type 1 and type 2 diabetes. If you are on an insulin-lowering medication, then you can drop your blood sugar lower than need be. So very high, very low blood sugars in both cases are contraindications of starting exercise. So again, as we take a break here, hit the thumbs up button, hit the like button, share and subscribe, and share this with loved ones and anyone you think will benefit from this important information. Hello, everyone. See Mary McCoy, Danielle Harding, Leon Dantzler, Karen Evans, Dennis Glenn. Dennis Glenn said, I saw a big drop. In my blood pressure. I went back to running. My BP today is 130/6 and haven't seen that in years. Awesome. Keep that up. More evidence for what we're talking about. And so there's a question about, does the study favor muscular legs? Yes. If you run heels and do weight training for the legs, your legs can become more muscular. Greetings to Blind Guy, his wife, their life. I met you guys in North Carolina earlier this year. And Daniel Harding, yes, I agree. Thumbs up, thumbs up. And thank you for the reminder, Danielle. So again, cardiovascular diseases. Now, cerebral apoplexy, based as a condition where you have stroke, cardiovascular accident, and apoplexy. Someone's had a stroke and have neurological or muscular problems or mental disorder. First, as physical therapy and rehab over that. But as one recovers, exercise has been shown to be helpful in this condition as well. So there's some evidence benefit of exercise. Type of training is going to be focused on walking and cardiorespiratory training and just improving baseline physical function. But as that part occurs, then you want to go to the next level. Oftentimes in medicine, we get a person that had a stroke and they go get them back to, say some modest level of functioning, and then we stop there. I mean, insurance companies stop paying for physical therapy, et cetera. And oftentimes in my patients, I recommend, okay, you've gotten your physical therapy, you recovered this point, now you need a trainer. You need to get out and move. You need to get out and work out. And I've had patients before, I had one patient in particular who had a stroke and was paralyzed on one side, and I had him working out with my trainer. And he was outside, walking heels and doing workouts and things, pushing the limits. And he benefited from that. Hypertension, we know that the normal physiological effect of hypertension, you decrease diastolic blood pressure, systolic blood pressure goes up during exercise. But overall, exercise can have a definite benefit in terms of reducing blood pressure. You want to be careful, of course, if you have someone with malignant hypertension, blood pressure is very high. You want to be careful with that because you want to make sure that it doesn't exacerbate it. And so when we see patients with hypertension, I will actually have them walk on a treadmill, see what their blood pressure response to exercise is. And depending on what that response is, I'll start an intervention. Here they talk about starting medications. I'm going to give you my take on that shortly after I kind of just go through this laundry list. So hypertension benefits from exercise, coronary heart disease, reducing inflammation, reducing plaque. There's some physiological benefits that improve coronary flow, coronary artery function. So that improves blood flow to the heart muscle and improves cardiac function. Types of training, aerobic exercise, you want to start off with some high intensity training. So high intensity training I like a lot because It's mostly aerobic, and you can, but there's some resistance components to it. So walking a hill, or climbing a hill, or running a hill, walking stairs, and doing an interval. So you have an intense period and then rest, an intense period and rest. I like that because there's an aerobic component to it, but the intense period is intensity in terms of, the fast component to it, but there's also increased resistance because oftentimes you may be lunging, whether it's like body weight lunging or, weight assisted lunging. Those are types of high intensity workouts that you're going to do. That's not only going to improve aerobic function, but also going to improve muscle function. Congestive heart failure is found to benefit from exercise. Oftentimes you have a heart failure patient lay down, don't do anything. No, I get my heart failure patients out and walking. One of my patients, she was in a hospital, severe heart failure. She had severe, regurgitant mitral valve and what have you. I put on the detox diet. We got off the Melanoma, got out of the hospital, and we had at the office, we would take her out and walk her and have her, walk stairs in the back. We have like a detention area there. We had her walk down into the detention area and up the detention area. And she got some benefit from that. And so exercise can be very beneficial for people with heart failure, congestive heart failure. And so you think these people need to rest? No, they need to get out and work out. But this needs to be in the context of a nutritionally rich, enhanced diet. I'm going to talk about that as I go through this. Intermittent claudication, that's due to poor circulation in the legs. That benefits from exercise. Walking is what they looked at the most, but step training, I think, can also help. Walking on a treadmill, doing walking up steps, or just doing a step exercise, go up the step, on the step up, step down, step up, step down. Those types of things. You want to go past the pain threshold. It helps improve vascular flow, helps the body, lower extremity, improve circulation, etc. Hello, Katie Miller. How are you today? Welcome. Happy Labor Day. And so pulmonary disease is chronic obstructive pulmonary disease. Now, exercise was not found to decrease the inflammatory component of pulmonary disease, but it did improve chronic respiratory function, which was thought to be due to the fact that improving cardiac function, also skeletal muscle function. So your diaphragm works better, your heart's working better. So your cardiorespiratory function overall is better. Bronchial asthma has been shown to improve. Cytokines, systemic cytokines, and TNF alpha has been shown to be reduced with exercise. And this could be the mechanism by which it helps with these inflammatory conditions, such as bronchitis and even cystic fibrosis. There was some benefit in patients with cystic fibrosis. But in all of these cases with the pulmonary disease, they strongly emphasize tailoring the exercise to the person's functional capacity. And that goes without saying, to be honest, with any of these conditions. Osteoarthritis. The emphasis of osteoarthritis and rheumatoid arthritis is that you have, osteoarthritis, sort of degenerative joint disease, rheumatoid arthritis, an immune-mediated joint disease. And they're very common disorders, particularly osteoarthritis, and they benefit from exercise. Now, the emphasis with both of these arthritic conditions is that you don't necessarily want to exercise the joint immediately unless there's rehab, range of motion. But for instance, if somebody has osteoarthritis of the knee, you want to exercise the hip and improve hip muscles or the muscle strength around that knee. That's going to help out with balance. So if you improve hip gait and strength and flexibility, that'll take some pressure off the knee, because oftentimes individuals may have more pressure on the knee because you have other joints that you're compensating for. And so improving the mobility and function of those joints around that, what seems to be the affected joint, can help that joint. Decrease in inflammation may also be a mechanism, although they do not see a direct correlation in things like decreased synovial fluid inflammation, et cetera, with the exception of a few synovial fluid biomarkers. Osteoporosis, we've long known that osteoporosis, certainly from the prevention side, benefits from exercise. Weight-bearing exercise are going to be the key exercise here. But of course, aerobic exercise is beneficial. And back to the intermittent, the intensity, high intensity exercise, where you're doing high intensity rest. There's both aerobic and weight bearing components to that. So walking, weight bearing, lunges, weight assisted lunges, climbing hills, climbing stairs. These are the types of things going to help osteoporosis. Some weight training as well. Back pain is benefits from exercise. We have a patient that we are working with now with back pain, and we're giving him some exercise to do. But these inflammatory conditions, whether it's inflammatory condition of the lung, inflammatory condition of the back, you have to have an adjunct, strong adjunct that decreases inflammation. We'll talk about that in a minute. Back pain, again, benefits. Now, there are different forms of back pain. Most of it's chronic degenerative back pain due to osteoarthritis. There are different subcomponents as ankylosing spondylitis, they talk about here, or Bechtereau's disease. Again, these are inflammatory conditions that have special clinical syndromes. Essentially, back training, exercise benefits the back if you improve core muscle strength, doing things like planks and things like that. The things that improve the core can also benefit. They talked about a variety of exercise, but things, aerobic training, high intensity exercise will also help with weight loss, which also may help with back pain. Rheumatoid arthritis, similar to osteoarthritis, you want to work joints around those joints, not directly affect the joint that's inflamed. Also, with back pain, you want to make sure that someone doesn't have an acute fracture. And similar to osteoarthritis, you want to make sure, and rheumatoid arthritis, you don't have an acute flared joint because you can exacerbate that. Cancer is a group of diseases, so it depends on what kind of cancer you have. But exercise in general, and we did a show on this before, how exercise improves mitochondrial function and it improves mitochondrial effects on the immune system. So, and also in some of the other studies, they showed how inflammatory markers, cytokines, tumor necrosis factors are reduced. Exercise also improves circulation, blood flow, so the immune system can go and attack the cancer considerably. So systemically, there are about physiological effects that are beneficial from exercise that favors the control of cancer, as well as some biochemical effects. So that's an overview of this. And also one thing about the amount of training, most conditions, they recommend at least 3 days a week. But there were some conditions, such as the metabolic conditions, where there was a desire for weight loss and insulin resistance. They recommend 7 days a week in some cases. So at least 3 days a week. I would say start off 3 days a week and work your way up to 5 or 6 days a week, depending on the condition. And what I recommend, you can go into certain phases where you exercise more intense, and sometimes and other times you back off. So here's a laundry list. You can do a screenshot of this where you have the general laundry list of things that exercise benefits is a list of 20: reduced body fat, increased lifespan, oxygenates the body, strengthens muscles, manages chronic pain, wards off virus, reduces diabetes, strengthens the heart, clears arteries, boosts mood, maintains mobility, improves memory, improves coordination, and strengthens bones, improves complexion, detoxifies the body. There's a detox effect with exercise. We've seen that before. Decreases stress, boosts the immune system, lowers blood pressure, and reduces cancer risk. So there you have it. Now, what I want to do is I want us to take a short break, and I want to come back and give you my perspective on this, because we actually have been using exercise in an informal way in my practice, and we're starting a new program that I'll talk to you about briefly tonight, but we will talk about a lot more in the coming weeks. So why don't we sit tight, and I'll wrap it up with my perspective and some recommendations, things in which you can do if you want to start, today or tomorrow. Okay, we're back for the next segment. Now, a couple of questions here I wanted to touch on first. Um, Blind Guides, why we always hit the button first. Thank you very much for being the leaders in that area. There's Kathleen Anderson, greetings from Massachusetts. So, good afternoon, Dr. Montgomery. How often should one exercise with osteoarthritis? The study, they recommend at least 3 times a week. I think if you have osteoarthritis, and it depends on, where it's a weight bearing joint or not, I would start with 3 days a week. I would start with things like flexibility. You can do lunges, you can, climb hills and things, but you want to work muscles around that joint, not necessarily the affected joint. But you start with 3 days a week and work your way up from there. At least 3 days a week, 30 minutes a day, and then build up from there. And then go to 45 minutes, 3 days a week, and then go 4 or 5 days a week from there. How do you reduce inflammation? I'm going to address that, Ms. Anderson Williams, in just a minute, because I think that's a very important question. Can resistance training increase the size of left ventricular hypertrophy? Will it be harmful? That's a great question. The answer is the cause of left ventricular hypertrophy is multifactorial in many cases, and is related to a lot of biochemical effects. My answer is, generally speaking, no. Now, if someone has uncontrolled high blood pressure and you're lifting weights, deadlifting weights, and you're not doing anything to address the blood pressure, then that kind of resistance training to an extreme level can worsen blood pressure and therefore contribute to left ventricular hypertrophy. But strength training in general does not. I'm going to explain why in just a minute as I go through these questions. Good evening. What do you think about bike riding if you suffer from hypertension AFib? I think bike riding is an excellent way to exercise. And Blind Guidance Wife for taking it off. Y'all have a good evening. Thanks for joining us tonight. Let's see, Chris Smith. This is great information. What is the best test to determine your cardiovascular endurance, health, heart rate zone for fat burning, anaerobic threshold? Oh my goodness, that's a very complex question. I'm not going to answer that in details beyond the scope, but here's some simple things you can do. The simple thing you can do is start with your resting heart rate. That's a very simple test that everyone can do because, testing metabolic threshold, you need, VO2, anaerobic threshold, you need special equipment for that. But a simple resting heart rate goes a long way. Now, a lot of things affects heart rate, but let's say you have a normal rhythm, don't have atrial fibrillation or anything like that. Then some of the major contributing factors of heart rate is going to be volume status. So if you dehydrate, it's going to be high, but also your conditioning level. So things like your endurance and health, you want to look at heart rate. Now, where should the heart rate be? I like people with heart rates in the 60s, ideally, resting heart rate in the 60s. And, it doesn't go up by more than, 20% with light, moderate exercise or something like that. If you have a heart rate in the 50s, assuming not on any medication like beta blockers or anything else that can slow your heart rate, or if you don't have thyroid dysfunction, et cetera, then and it's reduced to working out, that's related to high vagal tone, and you probably have a very good, endurance level. So resting heart rate is a simple test that everyone can look at. And if you start with resting heart rate in the 80s and you start working out, and then you notice the heart rate comes down to the 70s resting, then that's beneficial. Another thing you can do is you can look at heart rate recovery. So let's say, for instance, you have a simple step test. So you have many people buy these little step devices from the gym, excuse me, and you can do a step test. So let's say you do a step test for 30 seconds or a step test for 60 seconds. Measure your baseline heart rate, and then you do the step test, and immediately check a peak heart rate immediately at the end of the step test, and then see how long it takes your heart rate to get down to the baseline heart rate. So let's say your baseline is 70 beats a minute. You do the step test, and it gets up to, say, 120 beats a minute, 130 beats a minute, during the step test of 60 seconds. And then at the end, it comes from a peak of 130 down to 70. Let's say on day one, it takes 5 minutes to get back down to the baseline. Then you start working out, improving your condition. So then your new baseline heart rate is 60 beats a minute because you've been working out, let's say a month. You do the step test again. Instead of going to 130, it goes to 120. And then at the peak exercise of 60 seconds, then when you come down after it, when you recover, that heart rate, instead of taking 5 minutes to get back to baseline, it takes 90 seconds, or let's say 60 seconds, 1 minute to get back to baseline of 60. So that shows you that you had an improvement of your endurance and cardiovascular fitness, and there's some improvements of anaerobic threshold. Now, again, those are specific measurements that you have to make using equipment. Fat burning zone depends on your baseline metabolic condition. And so that's some other calculation you need. But I think heart rate is a very good way to get to that. Hello from New Jersey. Thank you for sharing your work. And thank you, Alicia Martin, for joining us tonight. It's taking it so actually I'm only doing the rebounding regularly. Oh, rebounding is great. Rebounding is good for lymphatic drainage. Later applying a bound on. What about low thyroid? What do you do? There are a lot of things that contribute to low thyroid function. And so it depends on why the thyroid function is low. We have a lot of people with low thyroid function because there may be increased autoimmune disease. Maybe, you had your thyroid removed, you have to be on supplements. So that's a different story if somebody has this low thyroid disease due to metabolic condition. We've had a number of people with low thyroid condition, low thyroid function, and just by improving their body's physiology and nutrition, thyroid function improved. Improve glutathione levels. There are different things you can do sometimes with supplements, iodine levels and things can be checked. Make sure there are no antibodies that are suppressing the thyroid. So there's some metabolic things you want to do as well. Does hyperthyroidism increase your resting heart rate? Hyperthyroidism does increase your resting heart rate. So that's something you want to look at or have your doctor measure thyroid function in this setting if you have an increased heart rate. Anemia can increase heart rate, infection. Volume depletion is one of the most common things that we see. Many people are just dehydrated for lots of reasons. We don't drink a lot of water. We don't eat a lot of hydrating foods. And we consume dehydrating beverages and foods as well. So how can I find out the reason why your thyroid is overactive? There are a lot of things you can do. You have to see an endocrinologist for the most part. What we do is we check antibodies. We check thyroxidase enzyme. We check anti-thyroid hormones, antibodies. And oftentimes we see those antibodies be elevated. And so you may have just an acute inflammatory reaction. We put our patient on detox to just kind of decrease inflammation. And oftentimes that helps a lot. So what is my take on this? I mean, obviously the data is pretty clear, and I don't think I had to do this talk for you guys to understand that exercise is beneficial in general. I mean, the laundry list, the 20 things I shared with you are pretty much many things we know, a lot of it through our personal experience, through experience of other people that we know. So what is the deal with exercise? Exercise is beneficial. However, I often emphasize that nutrition is really important with exercise. So you see all of these conditions that we talked about, they all have metabolic components that are key players in terms of their condition. So inflammation, for instance, in terms of osteoarthritis and hypertension and coronary disease and peripheral vascular disease, all these things are metabolic conditions. Inflammation plays a key role in them. Increased oxidative stress plays a key role in these things. Increased oxidative stress or increased toxic molecules that need to be neutralized with antioxidants. So how do you do that? Well, nutrition is going to be one central way, and I push a plant-based diet. So in our practice, what we do, and we start nutritional detox with raw plant-based foods because that hydrates the body very well. It detoxes by neutralizing free radicals very well. It reduces inflammation very well, and these are all scientifically validated things that we've shown in our studies and other people have shown in similar in the medical literature. So when you start off with a nutritional detox, you cleanse the body, cleanse the system. So let's say someone has osteoarthritis. You got lots of inflammation in the knee. When you detox, inflammation goes down, the knees feels better, and mobility improves. Back pain, similarly, inflammation goes down, mobility is better, exercise improve. Mental disorders, actually, there's these endorphin levels are increased, and so your mood goes up, so your desire to exercise increases. People have increased weight loss is improved drastically, so your mobility improves. So optimal nutrition really we use as a precursor to exercise. So we may put someone on a detox regimen for 1 week. The first week, they may either do light or no exercise, and after that first week, they start to exercise, and we increase the intensity over time. So what we have done is created a program called Heart and Soul of a Champion. You're going to hear more about this program down the road. It's going to be a docu-series released about this program. You guys are the first in the general public to hear about it. I couldn't hold back, and we'll be releasing the details later. But the Heart and Soul of a Champion is our integrated care. It's a documentation of our integrated care program. We use multiple modalities, nutrition being the core, exercise, fitness, sauna therapy, bema therapy, the other therapies. We use targeted supplementation to reduce inflammation, to reduce oxidative stress, improve circulation, and reduce inflammation. So this is going to be the core of getting the body working. And we have our workouts are primarily outdoors. We have some outdoor facilities that we use, and we use in groups. And so people will sign up as groups, and you'll be able to be part of this. So stay tuned. I'll bring you lots of information about Heart and Soul of the Champion. That's going to be coming near you. We're going to have a major open house in October, and the first season of the docu-series of Heart and Soul will be released the latter part of this year. We'll have some pre-release information coming to you within a month. So stay tuned and help pass the word. We'll have more information on future shows on Fresh Natural Live, and you want to stay on top of that, because I've learned, and based on the science that we use and clinical experience, that we need to be much more intentional with exercise. We've had individuals who are in their 80s and 90s with severe heart conditions, severe inflammatory condition, by just detoxing their bodies, adding exercise, adding things like sauna, target supplementation in certain ways. This aggressive, intense approach we're using has helped individuals turned around drastically. And we're going to continue to push the envelope using some of the basic approaches. So stay tuned. So let me see if there are any other questions. Alicia Martinez, to see my endocrinologist for my mother did blood work, wondering the specific tests, the requests, etc. For thyroid function, you want to look at TSH and the thyroid panel. Do you have a cure for tinnitus? That's a good question. I don't like to use the word cure because I think the body heals itself. Tinnitus is an inflammatory condition that affects the middle ear, and so you have this ringing in the ear. I have never detoxed anyone with tinnitus, and we typically send them off to an ear, nose, and throat person. I suspect that if your typical medications don't work, a detox regimen could, but we've never actually tried that on someone with tinnitus. The diagnosis of congestive heart failure, should one consider rebounder to clear the lymphatic system? Rebounding helps, I think, in all conditions, and I think it will help in congestive heart failure as well. You want to do that in the context of doctor supervision, but I think, yes, rebounding is a great exercise for congestive heart failure, among other exercises. So keep in mind, Heart and Soul of a Champion. You will hear more about that soon. I thank each and every one of you for joining us tonight on this Labor Day. And I look forward to seeing you next week when we talk more about some interesting topic. Until then, keep it fresh, natural, and live.